We are from Good Team. We are going to present about the shortages of healthcare workers. So we are going to explore the factors driving healthcare worker shortage. Second, social implication of healthcare worker shortage. Third, economy implication of healthcare worker shortage. And fourth, strategy to address healthcare worker shortage. And last is compare public and private sector in healthcare worker shortage. Now I briefly introduce our topic. The shortage of healthcare workers has become a serious issue worldwide, affecting the ability of healthcare system to deliver proper care and achieve universal health coverage. Malaysia, like many other countries, is also facing the challenge with its healthcare sector struggling to recruit and retain enough workers. So, by understanding this issue, we can better address the challenge and work towards a stronger healthcare system. Now, I present about the factors driving the healthcare worker shortage. Firstly, the working environment. Health workers face high workload and increased burden because of the shortage of manpower in the healthcare sector and high patient volume. Over time, this will lead to the physical and emotional exhaustion because they are regularly deal with life and death situation. Then this will result in high turnover rate and burnout. Besides, migration trend of health workers. International migration is common among health workers who are looking for better career prospects and better working environment. For example, the demand for health workers in developed countries is increasing, and this developed country also provide attractive wage earning. In Malaysia, there are also some professional health workers who migrate from rural area to urban area due to the lack of resources and limited job opportunity in the rural area. Therefore, this will lead to a large urban-rural gap due to the lack of health workers in the rural area. Next, education barrier. Medical progress are one of the most costly courses to study in higher education, and this will discourage the student pursuing a medical program. Moreover, medical programs require the graduate usually to complete years of course and practical training before they are prepared to join the industry. In general, it can take multiple years to become a fully licensed and registered physician. Lastly, one significant factor contributing to the worldwide shortage of healthcare workers is economic constraint. Inadequate investment in the education and training pipeline, together with the absence of stable job and job security, are the major consequences of the economy constraint. In Malaysia, medical graduates confront uncertainty due to the public healthcare system existing emphasis on contract-based employment, which limit their option for permanent position. Therefore, the profession long-term appeal is weakened by this instability, particularly in comparison to other occupations that provide more job security and more defined career path.
Assalamualaikum and good afternoon everyone. Today I will briefly discuss the social impact of the shortage of healthcare workers. The shortage of healthcare workers is currently a global issue. Hospitals and clinics struggle to meet the increasing patient needs, and healthcare workers face overwhelming stress, leading to burnout and resignations. This creates serious problems for patients, communities, and the healthcare system themselves. Fewer workers mean longer waiting times and rush care. Patients in urgent needs may not get help in time, leading to worse health outcomes. Vulnerable populations, like those in rural areas, especially those without proper roads, hits the hardest because they already have limited access to healthcare. This shortage worsens health disparities. In rural or disadvantaged areas, even treatable conditions can become fatal due to delays in care. These communities often lack resources and awareness, which puts them in greater risk for preventable diseases. For hospitals, this problem increases costs as they compete to attract workers. Smaller clinics especially struggle, which affects their ability to maintain the quality care. Patients also feel the impact as many turn to private healthcare, which is more expensive and out of reach for low-income families. Current healthcare workers are overworked and stressed, leading to mistakes. lower job satisfaction, and higher turnover rates. This also means fewer people are choosing healthcare careers, making the problem even worse. The administrative tasks also add to their burden, leaving less time for patient care. In summary, the healthcare workers shortage affects everyone. Patients receive poorer care, vulnerable communities face greater risk, and healthcare systems and workers struggle to keep up. Addressing this issue is essential to ensuring better healthcare for all. That's all from me. Thank you for your time.
Hi, my name is Susanna Gatun, metric number 293400. Today, I want to talk about an important issue regarding the shortage of healthcare workers in Malaysia and how it's affect the economy. In August this year, the Congress of Unions of Employees in the Public and Civil Services Malaysia, also known as QPEC, raised concerns with the Ministry of Health about the lack of healthcare workers, especially in the Hulu Langat district. They said that we need to take action to fill this position quickly. One of the issues highlighted is the new rule that limit maternity leave for medical officials to just 60 days. This rule is aimed at managing staffing shortage, but we must remember that our healthcare workers' well-being is also very important. Dr. Zulkifli Ahmad, Malaysian Health Minister, has warned us about this problem. He said that by the year 2030, we could see a shortage of nurses by as much as 60%. He said that both the public and private sector must come together to improve our healthcare facilities. If you don't take action now to address this shortage, it could lead to higher healthcare costs and poorer health quality for our people. As our population gets older and more people suffer from chronic diseases, the demand for healthcare services is increasing. This means that if we have fewer healthcare workers, patients will have to wait longer for appointments and receive less attention during their visits. When healthcare workers are overworked, they can experience burnout. This burnout can affect the quality of care they provide. The shortage of healthcare workers also raises healthcare costs. When hospitals and clinics struggle to find enough staff, they may have to pay higher wages to attract new workers. This increased costs often get passed on to the patients. This means that many people find it harder to afford the medical care they need. The president of the Life Insurance Associations of Malaysia, Mr. Liu, has pointed out that rising medical bills and treatment costs are making it very difficult for individuals, especially those in the lower middle income group, to buy health insurance. When healthcare costs increase, people often have to cut back on their spending in other areas of their life, such as shopping, dining out, or enjoying entertainment. This decrease in spending can affect many businesses, leading to lower sales. As a result, economic growth will slow down, which affect everyone in our community. In conclusion, the shortage of healthcare workers is a serious issue that requires our immediate attention. The concern raised by QPEC and the warning from Health Minister Dr. Zulkifli Ahmad show us that we must act quickly. By working together to solve this shortage, we can ensure that everyone has access to quality healthcare. It's not only improve the health of our people, but also support our economy as well.
My name is Ang Yong Chen, metric number 293567, and now I'm going to compare the health worker shortage problem faced by the public and private sector. The problem that faced by public sector is significant shortage of doctors and medical officers. According to Ministry of Health, houseman appointments, which is the employment of medical graduates, dropped almost 50% from year 2019 to the year 2023. There are 3,046 medical officers who resigned between years 2021 and 2023. Specialized doctors in the MOH also decreased by 57% between 2019 and 2023. This problem is mostly attributed by the contract system issue. The strict and unforgiving requirements, especially the mandatory relocation, lead to a loss in healthcare officers instead of retaining them. The problem faced by the private sector are relatively small than the public sector because of most of the resignation of public healthcare officers migrate to the private sector. The private sector faced difficulties in attracting and retaining nurses due to better pay and working conditions offered by other countries. The medical graduates also faced problems in the private sector, which did not provide sufficient training opportunities compared to the public health sector. This is crucial for gaining practical experience before they can specialize it. While both sectors also face nursing shortage, while the nurse to population ratio is 3.6 per thousand in Malaysia, is lower than the OECD average, which is 9.2 per thousand. This is because wages of the nurses in Malaysia are the lowest among the Asian region, and also overcrowded cost of increased demand, especially the pandemic, intensified pressure to the strained healthcare system and caused many healthcare workers leave due to the burnout and stress.
My name is Lo Wei Xiang. My matric number is 293592. I will be discussing key strategy to address the critical issue of healthcare worker shortage. Let's divide into three major areas of focus: improving working condition, second, investing in technology, and promoting career in healthcare. First, investing in technology can significantly elevate the burden on healthcare workers. For example, telemedicine enables healthcare services to reach rural areas while reducing workloads. Similarly, AI can streamline processes like diagnostics, patient tracking, and health administration, while mobile health and health solutions such as wearable device and mobile apps enhance patient monitoring and care delivery. Second, improving working condition is crucial for retention. This includes creating a supportive and safe work environment by providing protective equipment, modern facility, and childcare center to support working parents. Ensure adequate staff-to-patient ratio such as 1:4 can also reduce stress and boost job satisfaction. Lastly, promoting career in healthcare is essential for long-term workforce development. Collaborating with schools to introduce students to healthcare profession through career fair and workshop, providing detailed information and career path, and sharing inspiring story of healthcare professional can motivate the younger generation to pursue career in the vital field. By implementing this strategy, we can work toward a more sustainable and resilient healthcare system. That's all for me. Thank you.
So in conclusion, the shortage of healthcare workers is a complex problem that has deep implications for Malaysian healthcare system. With the right strategy in place, Malaysia can address the health worker shortage and build a sustainable healthcare system that provides quality care for all the citizens and improve public health, but also strengthen the nation's ability to achieve the development goal.